to be environmental.
We'll be beginning the meeting here in a couple of... We'll be beginning the meeting here in about 1 minute. If you haven't got your screen gallery view, you would probably want to do that. We all use one central microphone here in our operations center, so you'll probably want to be on gallery view. All right, Tracy, I have 2 o'clock if you want to unmute yourself and begin.
All right. Thank you all for joining us today for our May the 6th COVID-19 update with the Lake Cumberland District Health Department. I am Tracy Aaron, Health Education Director, and we have members of our executive staff team who will be answering some questions that have been collected over the past week. I do want to say that there is an option on YouTube Live for additional questions. So if you have questions, please type those in our chat box as we go through throughout the meeting. And I'm going to turn it over to you, Sean, and let you give us an update.
All right. We've been fortunate the last few days. We haven't had a whole lot of new cases. It seems like the social distancing and things that the governor has implemented is working well. About 3 or 4 weeks ago, our new cases, our cumulative confirmed cases was doubling between every 3 and 4 days, and now it's doubling about every 25 days. So it's spreading much slower right now during this time of social distancing. Now, as the economy starts to open back up and people start getting out and moving around, we expect to see the new case rate to increase. Hopefully not back to the point where it's doubling every 3 or 4 days. Hopefully with the continued use of not having social gatherings, and then when you are at work doing the social distancing and wearing masks and those types of things will keep this growing more slowly. One thing that we see a lot of people that seems to be confused about it is thinking that now that things are opening back up, that social gatherings is allowed. And the number one thing that is still prohibited is social gatherings. It isn't until toward the end of May that the governor is even suggesting we can meet in groups of 10. So certainly social gathering is not approved right now. That's our number one way to prevent the spread of this, or to at least to slow it down, to mitigate the slowing of it, is not having large social gatherings. We know more people are going to be out at work and so forth as things open up, but do remember not to be around crowds, that everything needs to be operating on a limited capacity, and that you still are observing social distancing, using barriers, using masks, and all of the other things about staying home if you're sick and covering your cough and so forth. So please help us do that. We've been really fortunate in Kentucky. We haven't seen the hospitals overwhelmed in Kentucky like we saw in other parts of the world and other parts of the United States. All of the things that the citizens are doing with social distancing has worked, and we want that to continue to work. Right now, we have experienced 178 positive cases district-wide. We have 5 people presently in the hospital with COVID-related symptoms. We have 21 folks who are on self-isolation. When we add those together, that means 26 of our 178 cases are currently active. Of the remainder, 133 of those have been released from isolation, which means that they've recovered to the point they're no longer of a concern. We're not following them, and that we've had 19 deaths. So the mortality rate in our district has been pretty high compared to other parts of the state and nation. But our, as far as new cases, our case rate, we're doing better than state average, and the state's doing better than national averages. So we're doing good on cases, but the cases we've had a pretty high mortality rate. So that's where we are right now. Tracy, I'll turn it back over to you.
Okay, thank you, Sean. As I stated a few minutes ago, we have members from executive staff team that will be answering questions. We got Stuart Spillman, who is our environmental health director, and we got Dr. Wayman, our medical director, Laura Woodrum, our director of nursing, Mr. Crabtree, and then Amy Tomlinson, our preparedness manager. So first question I think is going to go to you, Stuart. Why are smaller variety stores individually owned required, to be closed when the larger ones, such as Walmart and the Dollar General stores, open, with many people inside the store than the smaller stores would have had?
Okay, so on store closures, what we have to look at is two things. One, we have to look at what has been deemed essential by the governor's office, and we also look at what is deemed essential or critical infrastructure by the Department of Homeland Security's Critical Infrastructure Guide, which is called the CISA or the CISA. This outlines what an essential or life-sustaining business is. Walmart and Dollar General stores actually fall into essential and life-sustaining due to their sale of food. So the variety stores, their main sale is not, they're not a food store. So Walmart is a grocery store with other things. Dollar General stores now have become grocery stores with other things. So a variety store, in what I'm at least defining variety store here as, is a store that just, they sell a multitude of different things, but they're not a grocery store. They may have a couple of food items that they sell, but they may not even be permitted as a store that would sell. Just because you sell chips doesn't make you a food store. So the main sales are not derived from food, and they're not considered a life-sustaining retail business. And that goes for a lot of things fall into this category. So if it's an agricultural type store, then they would be considered life-sustaining, for example. So that's the reason why there is a difference. A shoe store is not a life-sustaining essential retail business, but a grocery store is. So I guess that's just kind of to make an example. That's about as close as how I would know to categorize that.
Thank you, Stuart. Laura, this question is for you. Could you explain the process of getting positive results from nursing homes and how the health department knows if the deaths from the nursing homes are indeed from the virus, coronavirus?
Yes, the health department receives positive test results from the providers who perform them and or the labs. Once we receive positive results, the health department reaches out to the facility to begin the contact and case investigation process. Death certificate review from the Kentucky Department of Public Health is how that the cause of death is determined.
Thank you, Laura. This one is probably yours. The next question is probably yours too. I would like to know if Governor Beshear has discussed his plan for testing long-term residents in nursing homes and the staff. I haven't saw his update lately, and didn't know if there were any new news in regards to nursing home testing.
The governor discussed plans yesterday to do testing in all long-term care facilities when he did his briefing yesterday. Some facilities across the state have identified positive cases and in turn chose themselves to do the testing and figured out avenues to get testing kits or testing media rather to have those labs processed.
And I would add, while we don't have an unlimited supply of testing kits right now, there are more testing kits in our district than there was even a couple of weeks ago. So we do have the capacity to access some kits. If we get a positive case in a long-term care facility, we can maybe test the staff and the patient or the resident and the folks who was closest to the resident. We have that ability now to roll that up and do that very quickly. So while there's not an unlimited supply of tests, there is some more availability.
Okay, thank you, Laura and Sean. Dr. Wayman, this one is going to be for you. People were already discussing on social media and in their social circles about a bad virus or illness that they had many symptoms that were similar to COVID-19, such as a fever, sore throat, tiredness, and a cough that lingered for approximately a month. But this was being reported by many people around Christmas of 2019 or January, so over the winter months. They say they recovered, but the illness would get worse again. They felt like they were getting better, but then the illness would get worse. And several seemed to think that they caught it more than one time. Many of these people said they were tested for the flu, but it came back negative. So in light of the recent situation in COVID-19, the question is, would they have had COVID-19 in December or January of this year?
Let me say before Dr. Wayman answers, we're getting close to the end of the questions that was submitted this week. So if there's anyone that's watching live, I think we've got over 50. If you have a question, please type it into the chat box, and we'll go ahead and be thinking about the answers while Dr. Wayman's answering the previous question.
It is definitely possible that these people with the appropriate symptoms did have COVID in December. Before a pandemic eventuates, the virus can be circulating in the community without being noticed. So these symptoms are very possibly COVID-19. The people that had these symptoms in December can now be tested with antibodies. Large labs like LabCorp and certain hospitals are already doing them. If the IgG, there are two antibodies, an IgM and an IgG. If the IgG is positive, then that person would have had the disease sometime in the past.
Okay, thank you, Dr.
Right.
Wayman. Interesting.
I do see one thing here in the chat box. Let me look and see what we got. Why is there not a testing site in Central Kentucky? So I'm not sure where we would be talking about Central Kentucky. In Lake Cumberland, that's the area we cover. It's, Darien, Casey, and Clinton, and Cumberland, Greene, McQuarrie, Pulaski, Russell, Taylor, and Wayne. We do have facilities that will test in all the counties right now. And again, there's not abundant testing where we could just test everyone, but we can get people tested if they need it. So we're constantly working on trying to expand the testing capacity, getting access to more tests, and making sure there's providers willing to do the testing. So that is something we're working on. She says in the Campbellsville area. I don't know, Dr. Wayman or Laura, do you want to mention anything about testing in Campbellsville?
When you say testing sites, I'm not. Do you mean the
places that are willing, where you could get a test if you were in Campbellsville?
Yeah, I understand. My understanding is the hospital receives those gravity tests, and I saw through their social media they are doing some testing there at the hospital, and other local providers are doing the testing. I don't think there is the agreement with Kroger and the little clinic, there's not one that has been set up in Campbellsville or South Central Kentucky, but other locations throughout the state.
And it's still similar to the way it's been in the past, that you need to, if you feel like you need to be testing, you still need to check around and see if your provider is doing the testing and what their criteria is. They may change their criteria from day to day depending on how much testing capacity they have. Let's see, it says, is the health department planning on hosting more free testing sites in the area? We are, is it in Cumberland County where the, so we've got one testing that's going to be going on here in a few days in Cumberland County that we will promote more shortly. But we're going to see how that goes, and if that goes well, then we're going to try to encourage other community partners to maybe roll that model up in other places across our district. So yes, it's something we are actively working on. We're also wanting to make sure that as businesses and stuff roll up and open, that there are providers in each county who, let's say the virus gets to spreading in some business somewhere, and the employees, a lot of the employees have to be off quarantine for 14 days. Well, instead of waiting the 14 days to come back to work, maybe you could get tested and test negative and come back sooner. So we want to make sure that, we're trying to make sure that there's providers in place in each county that could do some more focused testing in situations like that, so businesses wouldn't have to be shut down so long. So that is something we're working on. It says the governor has stated he will have some guidance on opening government buildings by May 18th. Will our health department have input on these guidelines? I don't think one size fits all. I think with most of these things, they're giving guidance, and then it's up to the local health departments to look at the guidance and how it's being implemented in our communities. And it is true that every situation is unique, and we have to look at every situation a little bit differently. So, we have some, we can't operate outside the bounds of the guidance, but we will work within the guidance as much as we can to be as flexible as we can so that the guidance will fit as many situations as possible. We don't have any other special influence with the governor as far as the guidance, other than, we make recommendations up through the State Health Operations Center about things that, we suggest should happen, and they either choose to integrate those things or not. We do know that, the things that the governor has implemented has definitely worked in slowing the spread of COVID-19, and we hope as we roll things up slowly, we can take all the precautions to avoid any spikes. It says, are the antibody tests now considered reliable, and do the results actually determine any immunity? So I'll let Dr. Wayman answer that.
The antibody tests have been used for a while, but of course they have not been used in the same sense as normally would have to be FDA approved. They have received emergency approval from the FDA. What was the second half of that question?
The question was, are the antibody tests now considered reliable, and do the results actually determine any immunity?
Okay, so if you get antibodies of IgG type, you hope that you are immune, at least in the short term. We still don't have enough tests or experience to say how long we can be immune for. However, since we are also using plasma from recovered patients to treat active cases, I assume that at least initially or shortly after the illness, people must be immune to some degree. And the testing within a test tube, in vitro testing, shows that the antibodies can actually neutralize the virus in culture. So it's hopeful that there is immunity. For how long, we don't know.
Thank you, Dr. Raymond. There's a question. Are you concerned about the beginning of the tourist season, the Ohio Navy and other boaters coming into the area? Will boating be permitted or will visitors be turned away? I can say as far as the marinas go that we're looking for extra guidance from the governor's office about the marinas and so forth. Stuart may have more specifics than that, but I do know we are concerned about anyone coming into our state from a state where there's more active cases or where there may be more active cases. But Stuart, do you have any other?
Yeah, I think right now the social distancing will apply on the marinas. Of course, marinas are open to boating, and you can still rent boats. They have to be cleaned and sanitized after each rental, or you can come on to your own boat. As we know right now, the governor's orders were a 14-day quarantine for anybody who come into the state from out of state. And as far as we know, that order has not changed, although that's been challenged in a higher court, and we're awaiting any changes to that. So just as of this moment, we don't have those changes, but we do know that the social distancing still is in effect on marinas. So if you go out to go to the lake and get on a boat, there's no gatherings up until the 25th, when the gatherings of 10 people or less would be allowed. So all that is still in effect. But yes, the marinas are open as long as they can go by the guidelines.
We've had a Zoom meeting like we're doing right now yesterday with the county judge executives and the mayors about all sorts of issues that might come up as far as when businesses open up, hoping that everyone will be compliant with the governor's orders. And we also had a call this morning with all of the county attorneys in the area about what would happen if we see a business not in compliance and we provide them a cease and desist order, and they're not willing to cooperate with that order, making sure that the county attorneys are ready to take the appropriate legal actions. And I have confidence as long as we're operating within the boundaries of the executive order that the governor's given, that the counties will back us up on that. So I think that's all the questions that anyone has posted. Do you have anything else, Tracy, or does anyone else in the doc have anything to add? Did you have any more questions, Tracy?
I do not have any more questions, Sean.
Okay, well then I will thank everyone for joining in. I hope these meetings are helpful. My closing thoughts are, remember that as we open things up, or as the governor opens the economy back up, then the number one rule about no social gatherings is still in place. Just wearing a mask or staying 6 feet away from each other doesn't supplant no social gatherings. It's not until the end of May that even gatherings of 10 will be allowed. So make sure that you understand no social gatherings. If you do have to be out or go to work, follow the guidance, stay 6 feet away from each other, wear the mask, stay home if you're sick, cover your cough, all those kinds of things. Has helped us to really slow down the spread of this virus over the last few weeks. So no other questions have come in. So with that, I will make one final thank you for everyone, and we will see you next Wednesday.